By the way, class, yung mga amoebic cyst natin, it has actually two forms. Okay? So, meron tayo yung mature cyst and an immature cyst. Now, madali lang ma-differentiate yung dalawang yan. Kung mature ba ito or immature yung cyst natin. You will base it from the number of their nucleus. Okay? Yung mga mature cysts natin, they are considered as quadrinucleated. Okay? So, they consist of 4 nuclei. While on the other hand, your immature cysts naman, they have, or rather, they consist only of 1 nuclei. Now, before we discuss the life cycle, let us define first what is encystation and what is excistation. Let us differentiate the two. Okay? Unahin lang natin yung excistation class. Excistation, this refers now to the transformation of cyst to trophozoite. Again, excistation, ito yung transformation of cyst to trophozoite. After the cyst has been ingested or swallowed by the definitive host. Now, encystation naman, on the other hand, this refers to the transformation of trophozoite to cyst. Okay, this is the transformation of the trophozoite to cyst. Now, encystation process class, it is mainly due to contributing factors. Okay, so meron mga factors na nagkukos ng encystation ng ating mga trophozoite. Number 1 dyan, encystation may occur due to deficiency or overabundance of their food. Again, encystation may occur due to deficiency or overabundance of their food. Number 2, it is mainly due to excessive catabolic products of the organism or associated bacteria. Number 3, due to marked change in pH. Okay. Number 4, it is due to encystation may be due to depletion of oxygen supply. And then lastly, it may be due to overpopulation of the organisms. Okay. Now take note class that this encystation process is essential for the survival of this amoeba, making them very resistant to gastric acidity. Okay? Making them very resistant to gastric acidity or desiccation. Okay? Yung drying. Okay? And then, encystation is also essential for them to survive in a moist environment. Okay? Now, that is why, once it has been ingested class, okay, excistation only occurs once it reach the intestine. Because yung mga trophozoites natin class, very sensitive yung mga yan. Very fragile. Okay? They are very resistant. Very sensitive to the acidity of the stomach. Kaya yung mga cyst natin, pag nasa gastric stomach pa lang yan, nasa cyst forms pa lang sila. Tapos mag-exist lang yung mga yan pag nakarating na sila sa intestines. Because very sensitive yung mga trophozoid natin. Now, let us talk about the life cycle of your Entamoeba histolytica. Now, the life cycle of Entamoeba histolytica, it consists of 2 stages. One of which, the infective cyst and an invasive trophozoite form. Again, it consists of 2 stages, an infective cyst and an invasive trophozoite form. Now, infection with E. histolytica, it occurs when the cysts are being ingested from fecally contaminated material. Alam natin yan, di ba? Yung mga amoebiasis, nakukuha yan sa mga maruruming pagkain or tubig. Okay, basta fecally contaminated yung mga yan. Now, other modes of transmission includes venereal transmission through fecal-oral contact. Venereal class, ibig sabihin sexual. Okay, sexual contact, lalo na kapag fecal-oral transmission. Then aside from this one, you may also acquire Entamoeba histolytica through direct colonic inoculation through contaminated enema equipment. Now, yung life cycle ng histolytica natin, class, it starts when the excistation occurs in the small or large intestine, wherein the cyst will undergo nuclear followed by cytoplasmic division to form 8 trophozoites. Diba? Ang excistation natin, this is the transformation of the cyst into trophozoite. Now, next. Now, these trophozoites na, yung trophozoites na namuo, they are said to be highly motile. And then they possess a pseudopodia, and they have the ability now to colonize and invade the large intestine. While on the other hand naman, class, yung mga cysts daw natin, they will never be found within the tissues. Of course, kasi non-motile naman yung mga yan. Okay, and then anong next natin, class? This trophozoid, okay, they will undergo binary fission, magmumultiply yung mga yan, and then this trophozoid may invade the intestinal wall, specifically the wall of the colon, entering now the circulation, and then it will migrate to the liver. Okay, they are capable of migrating to the liver, causing now liver abscess. Now, some organisms, class, kaya nilang pumunta sa lungs, actually, through migrating to the diaphragm and then into the lungs. Now, yung iba naman, class, kung hindi man sila magmamigrate, pwede naman silang magstay. Okay, now this trophozoid may rather return to the lumen of the colon, and then after some time, dun na lang sila magdi-disintegrate. Now, this trophozoid, once na, let's say, makompromise na yung kanilang nutrients, kapag wala na masyadong source of nutrients, okay, due to several factors, of course, they will undergo encystation. Okay, they will undergo encystation wherein yung trophozoid natin, magta-transform yan ulit into cyst. Okay, now, so from trophozoid, magta-transform yan into an immature cyst. Yan yung uninucleated natin. Okay. Immature cyst. Tapos, after some time, 2 nuclei are produced. And then, ay, nandito pala. Sorry. Okay. Again, class, ulitin natin. Mag-undergo yan ng encystation, wherein yung trophozoid natin, it will undergo several developmental stages. Okay, so from there, yung trophozoid natin, magta-transform into an immature cyst, 1 nuclei. Then after some time, magpuproduce yan ng 2 nucleus. Then finally, into a mature cyst. Okay, so 4 na, quadrinucleated. Now, once the cyst is fully matured, this time, yan na yung mapapass out sa feces. Now, by looking at this picture, class, both your cyst, your mature cyst, and a trophozoid is considered also the diagnostic stage. Okay, the diagnostic stage of amoebiasis. Now, let us go over with the clinical infections caused by your histolytica. Now, majority of cases associated with an Entamoeba histolytica is primary amoebiasis and extra-intestinal amoebiasis, such as your amoebic colitis, okay, such as your amoebic colitis, amoeboma, and amoebic liver abscess. Okay, so these are now the extra-intestinal amoebiasis associated with your histolytica. Okay, so your amoebic colitis, class, clinically, it presents as gradual onset of abdominal pain and diarrhea with or without blood and mucus in the stool. Okay, but most common cases, okay, pag amoebiasis yan, it is a bloody diarrhea. Okay, so for example, class, later in the future, kung suspected cases yan ng amoebiasis, tapos naka-receive ka ng let's say, watery fecal sample, Tapos, unang tingin mo pa lang sa microscope, ang dami mo nakitang RBC, you suspect it already with amoebiasis. Okay, so from that point, maghanap ka na ng e-histo kasi baka possible yan na amoebiasis. Okay, but not all the time. Now, although some patients may only have intermittent diarrhea alternating with constipation, the children may also develop fulminant colitis. Okay, with severe bloody diarrhea, minsan it is also accompanied with fever and even abdominal pain. Now, so ayun pala. Okay, bloody diarrhea. Now, amoeboma on the other hand naman, okay, it clinically presents as a mass-like lesion. Okay, mass-like lesion with abdominal pain and a history of dysentery. Okay, now sometimes this amoeboma, it can be mistaken for carcinoma. And then, amoebic liver abscess naman class, it is now the most common extra-intestinal form of amoebiasis. Again, it is the most common extra-intestinal form of amoebiasis. Now, the cardinal manifestations of amoebic liver abscess includes fever, okay, cardinal symptoms, fever, and right upper quadrant pain. Okay, fever and right upper quadrant pain. Now, important notes to remember lang class, okay, sa amoebiasis natin, okay. Important notes to remember, the invasion of the trophozoites will produce daw the characteristic flask-shaped ulcers. Okay, so dahil nga very invasive itong mga parasite na ito, they are capable of destroying the let's say the surface, the villi surfaces of the colon. Kaya nagkakaroon ng ulcer. Okay, they are capable of producing this characteristic flask-shaped ulcer. Now, the most common sites of amoebic ulcer are the cecum, the ascending colon, and even the sigmoid. Now, another important notes to remember, once the trophozoid will reach the liver, it will lyse both the inflammatory and liver cells. And then, later on, magkakaroon ng abscess. Okay, now this abscess becomes filled with necrotic, proteinaceous debris described as anchovy like sauce aspirate. Kung alam niyo yung anchovy class, yan yung parang bagoong. Okay? Anchovy like sauce aspirate. Now, punta tayo sa laboratory diagnosis of your Histolytica. Now, upon microscopic examination class, the following morphologic structure should be noted. Okay, so number 1 dyan, yung size ng cyst. Very important. Bakit importante na kumbaga ma-approximate natin yung size niya? Kasi it will be, or rather it will serve as your guide to differentiate it from other amoebas. Okay? What else from the size? Number of their nuclei also. You have to take note the number of their nuclei. Lalo na kung mature cyst ba yan or immature cyst. And then, aside from that, pwede mo rin yan magamit as basis of differentiation from the other commensal amoebas. Okay? Then, aside from this one, you may also take note of the location and appearance of their karyosome. The appearance of the chromatoidal bodies. Okay, so again, ano ang itsura ng chromatoidal bodies ng mga Histolytica? You have your cigar-shaped or sausage-shaped chromatoidal bodies. Then, of course, the presence of cytoplasmic structures. Cytoplasmic structures. Now, pag ito class, ginamit natin as basis in identifying your Histolytica. Now, of course, madi-differentiate na natin siya from other non-pathogenic amoeba. Now, the standard method sa laboratory diagnosis nating class, the standard method pa rin is, when it comes to parasitologic diagnosis, the standard method would be microscopic detection pa din. Okay, so microscopic detection of amoeba, of trophozoid and cyst in the stool specimen. Now, when it comes to diagnosing amoebiasis, ideally, a minimum of 3 stool specimen should be collected daw in different days. Okay, so again, ideally, a minimum of 3 stool specimens should be collected in different days. Now again, recall lang natin class, for detection of trophozoid, a fresh stool specimen, let's say, watery sample yan, it should be examined within 30 minutes. Kasi yung mga trophozoid nating class, most likely, mare-recover natin yung mga yan, especially sa mga watery fecal sample. Now, on the other hand naman, yung mga cyst natin, they are most likely to be found in a formed or semi-formed stool specimens. Now, using the direct fecal smear with saline solution alone, you may observe the trophozoid motility. Again, kapag NSS ka lang sumisilip, pwede mong makita yung kanyang motility. Pwede mong ma-observe. Okay, again, the motility of the trophozoid of your Histolytica, okay, it is described as a unidirectional motility. And then, concentration techniques such as your FECT and your methylate iodine formalin concentration technique are said to be more sensitive than the direct fecal smear examination. Now, we have this, your direct fecal smear examination, yung NSS, pwede mo siya actually lagyan ng methylene blue. Okay, yung NSS plus methylene blue, it will stain the amoeba as blue. Okay, of course. Okay, so pwede mo siyang ma-stainan, thus differentiating them from WBCs. Kasi class, kapag sinilip mo yan under the microscope, kapag na-overlook mo yan, actually halos magkamukha sila ng past cells, okay, ng mga WBC. Then, aside from this one, okay, microscopic examination using now NSS plus iodine, of course, the nucleus and the karyosome can be observed. Okay. Now, always remember, class, that the detection of Entamoeba histolytica trophozoid with ingested RBCs, lalo na kapag may nakita kang ingested RBCs by this trophozoid, it is considered as diagnostic. Again, yung kakalimutan yung key term natin, it is diagnostic of amoebiasis. Now, aside from all of these laboratory methods, meron tayong actually ginagamit na stool culture method, namely your Balamut's medium. Your Balamut's medium. What else? Your rice egg saline. Your lac egg serum. Robinson's and SM. De charot. Okay. Okay, your inoki. Your inoki medium. These are more sensitive compared to your microscopic examination. Although, itong mga ito kasi, they are not routinely available. Now, aside from all of those laboratory methods, meron na tayo actually mga serological tests available for diagnosing your Entamoeba histolytica. Okay, actually, meron na nga tayo mga available test kit. Okay? Hanapin ko, class, kung ano na yung tawag dun sa test kit na yon. Basta, I will tell you na lang next time. Okay? Now, differentiation. Always take note, class, that the differentiation of E. histolytica and Entamoeba dispar is nearly not possible by microscopy. Now, this can only be done by PCR, which is considered as the gold standard method, and ELISA and isoenzyme analysis. Okay? Again, ulitin ko, the differentiation between your E. histolytica and your Entamoeba dispar, they can only be done by PCR, ELISA and isoenzyme analysis. And then aside from this one, detection of antibodies in the serum is still the key. According to Belisario, it is considered the key in the diagnosis of extraintestinal amoebiasis, such as your amoebic liver abscess. Now, in terms of radiographic examinations naman, such as your CT scan, ultrasound, and even MRI, they are non-invasive procedures and they are sensitive methods in early detection of your amoebic liver abscess. Okay, so yun yung mga ating mga laboratory methods na ginagamit. Now, when it comes to treatment of your amoeba, always remember, class, that metronidazole is always the drug of choice for treatment of invasive amoebiasis. Now, aside from metronidazole, meron tayong other 5-nitroimidazole derivatives such as your tinidazole and your secnidazole. Okay, so these two drugs, they are also effective for treating your amoebiasis. And then another, we have your diloxanide furoate. Itong drug na ito, class, it is considered as the drug of choice, especially for asymptomatic patients. Now, in terms of prevention and control naman, okay, number 1 dyan, safe supply of water pa din for drinking or other household purposes. Now, this can be done through iodinization of your water or even hyperchlorination. Iodinization or hyperchlorination. And aside from this one, of course, sanitary preparation of food. And then, yung basis nga nung thermal death point of the cyst, which is 50 degrees Celsius. Now, I want you to familiarize yourself, class, with regards to the differential diagnosis of acute amoebic colitis from bacillary dysentery caused by your bacteria such as Shigella, Salmonella, Yersinia, and other species. Okay, so it is very important to differentiate the two, yung bacillary dysentery natin and your amoebic dysentery caused by your Histolytica. Okay, so please refer na lang to your handouts. I believe it is in your handouts naman. Okay?